Hello everyone, today we'll be studying about the non-pharmacological method of the behavior management or the guidance. It includes the communication, behavior shaping or modification, which includes the DCM, desensitization, modeling and the contingency management. The third is the behavior management or the guidance, which includes the ABCDIVRHH. A means the adversive conditioning, B means the biofeedback, C means the coping, D distraction, I for impulsion therapy, similarly VR voice control and relaxation, H for hypnosis. Communication guidance, it is a means by which the dentist get his point across, making himself understood by the use of word or expression. The type of the communication includes the verbal communication by the speech, non-verbal communication, that is the multisensory communication, which includes the body language, smiling, eye contact, expression of feelings without speaking, showing concern by touching the child, giving him a pat or giving him a hug, or it can be both using the verbal and the non-verbal communication. Now next we have the euphemism. Use of the euphemisms. Euphemisms are the substitute words which can be used in the presence of the children. The dental terminology and the word substitute for the air, wind, impression material, pudding or the mashed potatoes, anesthetics, sleepy medicine or the sleepy water, burr, brush or the pencil, caries, brown spot or the sugar box, explorer, tooth counter, evacuator, vacuum cleaner, the matrix, fence of the filling, rubber damp, raincoat, stainless steel band, ring of the tooth, stainless steel crown, hat of the tooth, x-ray camera, radiograph, picture and handpiece as the whistling. The behavior shaping. This is based upon the stimulus and the response theory. It includes the desensitization. Joseph Wolf used to remove the fear and the tension in the children who have had the previous unpleasant dental experience or the negative behavior. Desensitization is accomplished by teaching the child a competing response such as the relaxation and then introducing progressively more threatening stimuli. It is effective method for reducing the maladaptive. Tell so do. It is a cornerstone of the behavior management, was given by the Harold Adelson in the year 1959. Objective is to teach the patient aspect of the dental visit and to familiarize him with the dental setting to shape the patient response to the various procedure. Now, tell includes the verbal explanation of the procedure in the phrases. In telling, explain to the child exactly what you are going to do. Tell the child before you are doing it, while you are doing it, or after you have done it. The voice should be soft yet firm, confident and continuous. You should be truthful with the child, and if the procedure is going to be painful or uncomfortable, say so. Talk about the dental situation. Sometimes talking about the another things like distraction is indicated. Now so means the demonstration of the visual, auditory, olfactory and the tactile aspect of the procedure in a carefully defined non-threatening settings. The dentist can either demonstrate on himself or on a inanimate object. The noise of a running handpiece shows the child through the hearing medium. A pinch on the arm before the anesthesia administration demonstrates the child how to pinch the injection in the mouth might feel. It is wise to avoid showing the fear-promoting instruments such as the anesthesia syringe. Consequently, bringing the equipment from the behind the child or below the visual level is preferred. It is in selected situation the child can be shown the anesthetic syringe with the sleeve over the needle. On explanation, that is the instrument using the spray of the sleepy medicine on your tooth. Always remember multisensory approach. The child can see, touch, smell and the hear. Do. In doing, do what you said you would do. Use the same tone of the voice in telling what you are doing as you do it. Do not perform the task until the child has a clear awareness of what it is you are. The next is contingency management. The behavior management technique is based upon the B.F. Skinner's operant conditioning theory. It includes the positive reinforcement, negative reinforcement, omission and the punishment. The type of the reinforcers are the positive reinforcers and the negative reinforcers. The positive reinforcer is the one whose presentation increases the frequency of the desired behavior, and negative reinforcer, it is the one whose contingent withdrawal increases the frequency of a behavior. The materials includes like the stickers, pencils, small toys, preferably not the candies and the sweet meat as it causes the caries is rewards are given after the dental procedures and the bribes are given before. The bribe should not be given in the pediatric dental practice. Now the social, like the praise, positive facial expression, handshake, smile, hug, pat on the shoulder. Activity like the visit to the park or giving him to show a cartoon on the iPad during the procedure. Now the positive reinforcement, it is the presentation of the pleasant stimulus. Similarly, negative reinforcement, it is the withdrawal of the unpleasant stimulus, like the high speed handpiece can be substituted with the instrument hand instruments. Now timeout or the omission, it is the withdrawal of the pleasant stimulus to reinforce the good behavior. Now punishment, it includes the presentation of the unpleasant stimulus such as the voice control or the hand. So the next is the modeling. It was introduced by the Bandura in the year 1969, developed from the social learning principle. Procedure involves allowing the patient to observe one or more individuals like the model who demonstrate a positive behavior in a particular situation. Therefore, the patient will frequently imitate the model's behavior when placed in a similar situation. They include the live models like the siblings, parents of the child, etc., film models or the postures and the audio. The next behavior management or the guidance includes the distraction. It is a technique used to divert the patient's attention. Method of distraction includes the verbal distraction, viewing the familiar TV program, cartoon, audio-visual glasses, magic trick, music, and the eye movement and desensitizing. Next is the humor. The function of the humor socially, it helps forming and maintaining a relationship. Emotional anxiety relief in a child, parent and the doctor. Informative, transmit the essential information in the non-threatening way. Motivation, it increases the interest and the involvement of the child. Cognitive, distraction from the fearful stimuli. Next is the coping. It is defined as the cognitive and the behavioral effort made by an individual to master, tolerate or reduce the stressful situation. Now, the coping effects may be of two types, behavioral and the cognitive. The behavioral means the physical and the verbal activities which encourages to overcome a stressful situation, and the cognitive is the child may be silent and thinking in his mind to keep calm. The next is the voice control. It is the modification of the volume, tone, pace of one's own voice in an attempt to dominate the interaction between the dentist and the child. Next is relaxation. This is the technique used to reduce the stress and is based upon the principle of elimination of anxiety. Relaxation involves the series of the basic exercises which may take several months to learn. Hypnosis. Hypnosis is the altered state of the consciousness characterized by the heightened suggestibility to produce the desirable behavioral and the physiological changes. Hypnosis is one of the most effective non-pharmacological therapy. A greatest benefit is the reduce the anxiety and pain. Now there is implosion therapy which includes the home, voice control and the physical strain. Similarly, we have the adversive conditioning. It is mainly for the extremely negative behavior, and the common methods used here are home and the physical strains. The next is the biofeedback. It involves the use of the certain instrument to detect the certain physiological process associated with the fear. For example, if the blood pressure is high, the instrument gives the stimulation and subject is taught to control the signals. Therefore, it is useful in the anxiety, stress-related disorders. Electroencephalogram, electromyography can be used in the